Hello my dear students, I'm Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I love it. We've completed hip bone part 1. This is hip bone part 2. A request as usual to all of you, please sit with the hip bone in your hand. Okay. Also sit with the same side femur and maybe the sacrum as well. So as you articulate the bones, you begin to understand them way better. So assuming that you've done that, what did we learn in hip bone 1? In hip bone 1, we spoke about upper end and lower end of hip bone. Then we spoke about anterior border and we just introduced ourselves to the posterior border of ilium. Okay, so just to revise briefly, hold the bone in its normal anatomical position. This is ilium, this is ischium and this is pubis. Okay, get that. We are presently discussing the ilium. We've done the iliac crest. We've done the anterior border. We are on to this posterior border. Correct? Come. Remember, I asked you a lot of questions and there are MCQs on the topics. Everything is available in the notes section or on my website vbanatomy.com. So let's go to the posterior border once again. This is posterior superior iliac spine, posterior inferior iliac spine. This is the greater sciatic notch. Were you to go further downwards, you would come to the ischial spine. And this blue line is your posterior border. Okay. Now pick up the bone that you're holding. Let's zoom in on it and see where is the posterior border. So this is your normal anatomical position of hip bone. I'm going to just rotate it a little bit so that you can see the posterior superior iliac spine, posterior inferior iliac spine, the great sciatic notch, ischial spine, lesser sciatic notch. Okay, I want you to note this very carefully. Posterior superior iliac spine, posterior inferior iliac spine, greater sciatic notch, ischial spine, lesser sciatic notch. Note that there are two notches, greater sciatic notch, lesser sciatic notch. In between them a spine, ischial spine. Clear in your mind? Come to the screen. So these two notches are greater sciatic notch and lesser sciatic notch. Clear? Now let's understand something. What happens is two ligaments are attached here. One that goes from the sacrum and ilium to the ischial tuberosity, sacro-tuberous ligament. One that goes from the sacrum to the ischial spine, sacrospinous ligament. Can you see how these two ligaments, which are attached to the bone, convert the notches into foramina? You no longer have a notch, you have a foramen. Did you see the diagram to understand? Greater sciatic foramen, lesser sciatic foramen. And the amazing thing is that structures inside your pelvis, okay, or in the walls of pelvis, make their way out through the greater sciatic foramen. These foramina act as communications between your gluteal region and your pelvic structures. Okay, so that's what makes these foramina very significant. Come. So what is sacro-tuberous ligament? From the sacrum and from the ilium to the ischial tuberosity. What is sacrospinous? From the sacrum and coccyx to the ischial spine. Details are given here, you can read up. Remember, both of them help to convert the greater sciatic notch and lesser sciatic notch into greater sciatic foramen and lesser sciatic foramen. Clear? Right. So now we come to something very fun. 10 structures emerge out of greater sciatic foramen. Okay. So see, this is your greater sciatic notch, isn't it? Now, this is the foramen. Imagine there are 10 structures coming out from it. Okay. You're going to need to know all 10. I'll tell you how to remember it. We use a lot of images, okay, students, to try and understand. Remember, it's important that you remember. The best way to remember would be by understanding. 10 structures, 10 fingers. 1, 2, 3, 4. Okay. So 1, 2, 3, 4 are all gluteal. 1, 2, 3, 4 are all gluteal structures. Okay. So they are, how do you remember? They are superior gluteal nerve, superior gluteal vessels, inferior gluteal nerve, inferior gluteal vessels. What is common to all of them? Gluteal. So 1, 2, 3, 4 are gluteal. Superior gluteal nerve and vessels, inferior gluteal nerve and vessels. Clear? What about 5, 6? 5 and 6 are nerves to something. Nerve to obturator internus, nerve to quadratus femoris. Revise. 1, 2 are superior gluteal nerve and vessels. 3, 4 are inferior gluteal nerve and vessels. 5, 6 are nerve to something. Nerve to obturator internus, nerve to quadratus femoris. Now 7, 8 are two nerves that travel together. Sciatic nerve and posterior femoral cutaneous nerve of thigh. These are two structures that travel together. They don't separate much. Okay, so let's put them together. 9 and 10 are structures which are referred to as pudendal. 9 and 10 are structures called as pudendal. What pudendal? Internal pudendal vessels and pudendal nerve. What is common to them? Pudendal. So this is how 10 random names are remembered by you so beautifully. Now we're going to add images for you to understand this even better. Come. So this is your hip bone. You know it, I know it. Okay. Now let me attach the sacrotuberous and sacrospinous ligament to it. Let me get the piriformis muscle to emerge out the greater sciatic foramen, partly taking origin from it. Okay, so that's my piriformis. Now, structures above piriformis are superior gluteal nerve and vessels. Structure immediately below it is the inferior gluteal nerve and vessels. So this is superior gluteal, this is inferior gluteal nerve and vessels. That's 4 structures down. Emerging and passing downwards into the back of your thigh, sciatic nerve and posterior femoral cutaneous nerve of thigh, they travel together. So we put them together. 6 structures down. Okay. Now, here you can see a number of structures emerging out of greater sciatic notch, passing back through the lesser sciatic notch. These structures are pudendal nerve and internal pudendal vessels. So pudendals are done. Pudendal nerve, internal pudendal vessels. For your information, pudendal nerve is the very important nerve of your perineal region, very important part of your control of the bladder as well as a number of other sexual functions. Okay. Now what is left? Nerve to one and nerve to the other. So here you have nerve to obturator internus, nerve to quadratus femoris. Observe, you've got all 10 structures on your screen in the form of a beautiful image. Superior gluteal nerves and vessels, inferior gluteal nerves and vessels. Sciatic nerve, posterior femoral cutaneous nerve of thigh. Pudendal nerve, internal pudendal vessels. And nerve to obturator internus, nerve to quadratus femoris. It's all very logical, very easy if you put some kind of a method to it. Randomly remembering this will be near impossible. Right. So we'll use some more images and see if we can get these answers out automatically. Okay. So I can see this is piriformis, something emerging above it. Has to be superior gluteal nerve and vessels. Something emerging immediately below it has to be inferior gluteal nerve and vessels. 2 nerves traveling together piggyback. Sciatic nerve, posterior femoral cutaneous nerve of thigh. There. Structures coming out of greater sciatic going back through lesser sciatic, pudendal nerve, internal pudendal vessels. And this little nerve also accompanying them is the nerve to obturator internus. Ma'am, where is my quadratus femoris nerve? Nerve to quadratus femoris is not there in this. Why is it not there? It's not there because it's one of the few nerves which is very deep. So go to the next image to understand. See, in this image, I have removed a lot of muscles. Can you see that even the tricipital tendon here has been removed? As you remove this, you see the nerve to quadratus femoris lying here. Did you see it lying here? Deep to the tricipital tendon. That's why you didn't see it in my earlier image. Remember, osteology is not being some kind of a crazy fiend and remembering all the details of bone. Not at all. Osteology is using the bone to understand the musculature, to understand the nerves related, and to understand the functioning. If you do that and study the osteology is a part of the body as a whole, then only it's going to make sense and then only it's going to benefit you as a student. Otherwise, it's just challenge to your memory. I can challenge you, you can challenge me. There will be no benefit out of it. Right. So I have a question for you. What are pin structures? Pin, P-I-N, obviously a mnemonic. Right? Come. So here you are seeing some structures coming out of greater sciatic foramen, going back through lesser sciatic foramen. You know they are pudendal nerve, internal pudendal vessels, and nerve to obturator internus. Pudendal nerve, P. Internal pudendal vessels, I. Nerve to obturator internus, N. P-I-N, pin structures. Got it? So here take a look. This is the pudendal nerve. This is the internal pudendal vessels, and this is the nerve to obturator internus. From medial to lateral, the structures emerging out of greater sciatic foramen, passing over the ischial spine, back through the lesser sciatic foramen are P-I-N, pudendal nerve, internal pudendal vessels, and nerve to obturator internus. Okay, remember this, it's asked very often and you should know it. Pin structures, right. So what is their anatomical significance? The significance lies in the fact that the structures come out of greater sciatic foramen and then they go right back through the lesser sciatic foramen. They are posterior relations of your ischial spine. I like to think of it this way. It's sometimes, you're in a great hurry to come out of your hostel room. There are 3 of you in one hostel room usually. So you come out, you quickly come outside. And then when you come out, you realize that today I actually wanted to study in the room. I didn't want to go to college at all. So you come out and then you go right back inside, isn't it? So that's what these structures are doing. They come out and then they realize my activity today is not in the gluteal region at all. So they turn back and this time through the window they come back into the room. Okay? So that is something, if it helps you, use it. Otherwise use the diagrams. But remember what are pin structures. Okay? Right. So what have we completed? We've completed posterior border, greater sciatic notch and foramen, structures passing through the foramen and the pin structures. Let's continue to a little bit of the rest of the lecture, the medial border of ilium. Very easy. This is your normal anatomical position. Just tilt the bone a little bit to understand. From the iliac crest, can you see this border? From the iliac crest, it's descending downwards. Initially here, then forming the anterior border of the sacral articular surface, and then continuing down in this manner till the iliopubic eminence over here. Okay? Do this again. Be careful, it's important. From the iliac crest, the line descends downwards till the iliopubic eminence over here. Okay? Can be divided into the upper part before the sacro-iliac joint, part which is related to the sacro-iliac joint, and the rest of the line till the iliopubic eminence, which is called as the arcuate line. Okay? Now, significance of this, we can do this here. Remember, this line helps to divide your ilium into a iliac fossa over here and a sacropelvic surface over here. Okay? This surface is your iliac fossa. This is your sacropelvic surface. Okay? Your sacropelvic surface and your iliac fossa. Sacropelvic surface. Iliac fossa. Get that in your brain. Okay? Come. So this is your medial border, my dear students. This is the upper end at the iliac crest. This is the lower end at the iliopubic eminence. You can see that it separates the iliac fossa from the sacropelvic surface here. On the just lateral to the medial border, you find the attachment of iliolumbar ligament. Further descending down, it forms the anterior edge of the auricular sacral articular surface. Here you can see the auricular surface of sacral articular surface. And this here is the arcuate line, okay, which continues on to the pubis at the pecten pubis, which further continues forward as the pubic crest. Now this is very important. I'll tell you why. Now here you are looking at an articulated pelvis as it is found in your body. Okay. What happens is there is an abdominal content and there is a pelvic content. and the pelvic contents are separated from the abdominal content by an edge which is called as the pelvic inlet that's been drawn here for you. This is the pelvic inlet. When a structure crosses this, it enters into the actual pelvic cavity, which is quite small actually. Okay, so the pelvic inlet is formed by sacral promontory, anterior border of sacrum. Follow the arrows if you're not able to understand. Then it's formed by this entire line on this side and on the other side, which is called as linea terminalis. Linea terminalis is equal to arcuate line over here, pecten pubis and pubic crest. Okay, pecten, this red line is pecten pubis and pubic crest. Together these three structures form what is called as linea terminalis, and joining the two linea terminalis in the middle is your symphysis pubis joint, and thus there is formation of a complete structure which is called as pelvic inlet. It is through this pelvic inlet that the baby's head passes to enter into the true pelvis and finally emerge out during the time of parturition. Imagine that this small inlet that you see is what the baby's head is going to pass through. No wonder parturition is such a challenge for so many mothers. Right, so what have we completed? We've completed anterior border, posterior border, medial border. Okay, now we'll move on to the surfaces: iliac fossa, sacropelvic surface and the gluteal surface. So I told you this was the iliac fossa. By name, does it make you remember some muscle? I'm sure you remember iliacus muscle, which takes origin as shown here. This is where the iliacus muscle takes origin. Iliac muscle, iliacus muscle forms the floor of which triangle? Yes, forms the floor of femoral triangle. Good. Now here is your sacropelvic surface. Here is your sacropelvic surface. Partly it forms a sacro-iliac joint. I'm going to show you something. Wait. See, this is your sacrum, okay? And this is your hip bone. So, how do they articulate? This is the sacral articular surface. This is the articular surface on the hip bone, ilium. So, they go and articulate in this manner. This is how, if you were to add the other side hip bone, there would be formation of a complete pelvis. Isn't it beautiful? I hope you find the beauty in it. So, now you've seen the sacral articular surface. Held in place, the two bones which are transmitting weight are tightly held together by ventral sacroiliac ligament, dorsal sacroiliac ligament and an interosseous sacroiliac ligament. Stop. If there's an interosseous sacroiliac ligament, then what is this joint classified as? Yes, it's classified as syndesmosis and also classified as a plain synovial joint. Sacroiliac joint is classified as plain synovial as well as syndesmosis. Syndesmosis because of presence of interosseous sacroiliac ligament. Great. So that's the classification. Now let's talk about this little sulcus here. Can you see these lines I have drawn? Preauricular sulcus. This is something very interesting. See, preauricular sulcus is a sulcus that gets created when the ventral sacroiliac ligament gets very much stretched in a pregnant female. Okay, so will you find a preauricular sulcus in a non-pregnant female pelvis? No, you won't. Preauricular sulcus therefore is a way of recognizing the pelvis, sex of the pelvis. If preauricular sulcus is there, you immediately think, can this be a female pelvis? Is it any female pelvis? No. Can this be a pelvis of a Paris female? A female who has undergone at least one pregnancy? Yes, that's how bones also give you hints about their own history. Isn't it amazing? Okay, so it also gives a little bit of attachment to the piriformis muscle. Right. So what is the significance of preauricular sulcus? I've already given you the answer. It gives you an indication that this pelvic bone that I have in my hand belonged to a female who had undergone at least one pregnancy. Okay, so we go to the last part of today's class, which is the gluteal surface. Very easy. Gluteal surface is hold the bone in its normal anatomical position, this surface is the gluteal surface. You can already see that there are several lines drawn on it. Okay, let's discuss it here. The gluteal lines, there are three: posterior, anterior, inferior. All three gluteal lines begin at the greater sciatic notch. The posterior goes from the upper border of greater sciatic notch to the iliac crest. Anterior goes from the deepest part of greater sciatic notch to the iliac tubercle. Inferior goes from the deepest part of greater sciatic notch almost till the anterior inferior iliac spine, as you can see over here. Why are we dividing this? Because in between them there is attachment of the famous gluteal muscles. Here is the attachment of the gluteus maximus behind the posterior gluteal line. Here is the attachment of gluteus medius, and here is the attachment of gluteus minimus. Okay, gluteus medius between anterior and posterior, gluteus minimus between inferior and anterior, clearly visualized here. And what takes origin below gluteus minimus? Between the inferior gluteal line and acetabulum? Yes, the reflected head of rectus femoris. So with this we complete the ilium part of hip bone. The next lecture is going to be ischium, and then there will be the pubis. I hope you're enjoying this, and I hope you're learning a lot from these lectures. That's the idea. Okay, so please go into the notes section, please solve all the MCQs given, so that when you come for the next lecture, you're armed with knowledge. Okay, thank you, students. I'll see you in my next lecture.